Welcome back. In the United States, someone has a heart attack every 40 seconds. What are the major risk factors of a heart attack? Is there anything you can do to know if you are at risk or anyone that you know is at risk? Joining us to tell us more is Dr. Leandro Slipczuk, cardiologist and director of Cardiovascular, that's a really big one, and Lipid Disorder Center at Montefiore Einstein Center for Heart Disease. Thank you so much for being here.
Thank you for having me.
I am having all these medical terms today, so these long words. So excuse the tongue twister.
Yeah.
Thank you for joining us to tell us more about heart disease and what one can do to prevent themselves of having a heart attack and what can be done. I think most people always say, if I'm exercising, if I'm, eating right, then that's enough. Is it enough?
Let's go back and start with what a heart attack is.
Okay.
So the heart is a pump that just brings blood to the rest of the body. Mm-hmm. And in order to function, it needs its own blood that is brought by the coronary arteries. So atherosclerosis is a disease where these cholesterol plaques can accumulate in these arteries. And according to different risk factors, these plaques can rupture, and that causes a blockage in your arteries. When the blood doesn't get to the heart part of the heart dies, and that's called a heart attack. Mm-hmm. And that's very common, like you said, and it's the number one killer in this country.
And it's still, I would think that, with all the information that we've had through the years about heart disease, that the numbers will actually decrease. But are they staying the same? Have they increased?
Yeah, there's some improvement in the treatment in particular of heart disease, but it's very important to detect it early, and once you have a heart attack, to prevent a second heart attack from happening. Mm-hmm. So it's very important to know the main risk factors for a heart attack. Some of these are high blood pressure, hypertension, that it's very important and very undetected, because you can have high blood pressure and not know about it because you may not feel it.
Which is also hereditary, right?
It has a hereditary component, yeah, and then it's related to another one, that is obesity and to high salty food and to what we eat. Mm-hmm. The other one is cholesterol. So if you have very high cholesterol, that can accumulate in the arteries. And a particular one in this case could be genetic, like you're saying, and it's called familial hypercholesterolemia. That is a genetic disorder that increases the cholesterol very, very high. Mm. The other one is diabetes. That is when the blood sugar is high in your blood. And that's very important to screen for as well, because you may have high blood sugar and not realize about it. And then obesity, that is very common, especially in our community, and lack of physical activity and diet and smoking. Those are the main risk factors that are important to know.
So what is Montefiore doing to make sure that our community knows their information and, all the preventive measures that they can take to make sure that they don't get a heart attack?
Sure. So, this is a teamwork that is not only by cardiologists, so it's very important, and we have a lot of doctors, PCPs, internal medicine doctors, cardiologists, endocrinologists. But right now we created a new program that is called Metabolic program. The importance of this is that some patients have multiple of these risk factors going on, and we know by recent data that it's not uncommon to have these risk factors not well controlled, even after a heart attack. So we created this clinic, Metabolic Clinic, where we have an endocrinologist, we have a pediatric cardiologist, we have a heart failure specialist and transplant specialist, a chronic kidney disease specialist, and myself. The idea is that these patients could be complex, and in this way, someone can come to the clinic and see a different specialist on the same visit, and then we come with a plan all together to provide better care.
And this is covered by most insurance?
Yes,
by
absolutely.
Most health insurance?
Absolutely, yeah.
So talk more about the clinic. Is it going to be at all Montefiore hospitals here in the Bronx, or is it just at a specific location?
So the clinic is starting at Hatch, at the Hutchinson campus.
Okay.
And the idea is that with time it will expand. Because as we know, in this community, we have a lot of diabetes, a lot of obesity, a lot of heart disease. But it's very important to detect these risk factors, to control them, especially if you had a heart attack or if you have extremely high cholesterol with a family history of a heart attack. We provide also genetic testing where we can see if the problem is genetic, and then your family can be screened. Mm-hmm. That's the idea of having a pediatrician working with us as well. So if you have something called familial hypercholesterolemia, where your cholesterol is very high, especially if the bad cholesterol is above 190, you should be thinking you may have a genetic component of it. And then we test the gene, and your whole family can be screened. So it's important for early detection and treatment.
What can someone do right now to improve their cardiovascular health?
So first is knowing your risk factors, right, like we were talking about. Then knowing your numbers, so you should know if your risk factors are controlled or not. And then the other thing that we can do is, traditionally we've used these scores that we use based on population studies to know if you're at risk. We have looked at thousands of patients and then taken the risk factors into account and see who is at higher risk. The problem is that certain communities, in particular Hispanic communities, have not been well represented in many of these trials. So another option that we have is called calcium score, where we do a CAT scan of your heart, and then we can see if you have plaque that is forming in your heart, and then treat it accordingly. This is mostly important if you never had a heart attack and if you are in the intermediate risk, and it's a cheap test that provides a lot of information.
Excellent. Dr. Slipczuk, thank you so much for being here with us.
Thank you for having me.
Thank you. For more information, you can visit their website at montefiore.org or call 646-670-5120. Don't go anywhere, because when we come back, we'll learn about a concert celebrating Dominican music. Stay tuned.